For centuries, hospitals were not seen as safe places. For many people, entering a medical institution meant accepting a very real risk of never returning home. In an era before antibiotics, sterilization, and even the understanding of how diseases worked, European hospitals often became environments of suffering, infection, and death. Doctors performed surgeries without washing their hands. Blood-stained aprons were worn repeatedly, and were seen almost as symbols of professional prestige, proof of years of accumulated experience. Surgical instruments passed from one patient to another without any proper cleaning. In many cases, physicians walked directly out of autopsy rooms to examine living patients. And the most disturbing part is that nobody realized how dangerous this was. At the time, medicine was still trapped in ancient theories about how the human body functioned. Many believed diseases were caused by miasmas, invisible contaminated vapors present in the air. Others argued that illnesses came from internal bodily imbalances, emotional disturbances, or even divine punishment. The idea that something invisible could be carried on the hands of doctors themselves sounded absurd. But in the 19th century, one physician began noticing a terrifying pattern inside one of Europe's largest hospitals. Young, healthy women entered maternity wards ready to give birth, and just days later, they were dead. Some developed violent fevers shortly after childbirth. Others suffered intense pain, inflammation, and infections that rapidly spread throughout the body. In many cases, death came within days. Most frightening of all, these deaths seemed to affect mainly women treated by doctors. Meanwhile, patients cared for by midwives survived in far greater numbers. The difference became so well known in Vienna that many pregnant women begged not to be taken to certain hospital wards. Some preferred giving birth in the streets rather than risking admission to particular maternity clinics. It was in this environment that a Hungarian doctor named Ignaz Semmelweis decided to investigate the numbers. What he would discover would reveal one of the most disturbing truths in the history of medicine. Doctors themselves might be killing their own patients, and even worse, despite the evidence, almost nobody wanted to believe him. This is the story of the experiment that revolutionized modern medicine, and of the man who tried to convince the world that something as simple as washing hands could save millions of lives. Stay until the end and tell me if you had ever heard this story before. During the first half of the 19th century, European hospitals faced a devastating problem known as puerperal fever, also called childbed fever. The disease affected women just days after childbirth and was one of the leading causes of maternal mortality at the time. Symptoms usually began with high fever, chills, and intense abdominal pain. Soon after came severe inflammation, widespread infection, and rapid deterioration of the patient's condition. Many women died in extreme suffering only days after giving birth. To doctors of the era, it seemed almost like a hospital curse. The most terrifying part was that nobody understood exactly what caused the disease. At that time, medicine still had no knowledge of bacteria, germs, or microorganisms. The germ theory of disease did not yet officially exist. The idea that microscopic organisms could cause infections would only be accepted decades later. Many physicians believed illnesses were caused by miasmas, invisible vapors, foul odors, or contaminated particles in the air. Others blamed the deaths on emotional factors related to childbirth, weakness of the female body, hormonal changes, or even divine punishment. In other words, medicine had countless theories, but no real answers. And then an impossible detail to ignore emerged. At the Vienna General Hospital, one of the largest and most important medical institutions in Europe, there were two maternity clinics operating side by side. Both received similar women. The patients lived in the same city, had similar social conditions, and were treated inside the same hospital. But the mortality rates between the two clinics were completely different. In the first clinic, where doctors and medical students treated patients, mortality from puerperal fever sometimes exceeded 10%. That meant more than 1 out of every 10 women could die after childbirth. Meanwhile, in the second clinic, managed primarily by midwives, the number of deaths was far lower. The difference became so well known among the population that many women begged not to be admitted to the first clinic. Reports from the time indicate that some pregnant women even knelt down and pleaded to be transferred to the midwife's ward. Others preferred giving birth in the streets of Vienna under terrible conditions, because they believed it offered better chances of survival than entering the hospital's medical clinic. And perhaps the most disturbing part is that they were right. It was in this atmosphere of fear, death, and desperation that Ignaz Semmelweis began his investigation. And the more he observed the numbers, the more terrifying the truth became. Ignaz Semmelweis was a Hungarian physician working in the maternity ward of Vienna General Hospital during the 1840s. Unlike many of his colleagues, Semmelweis had an unusual characteristic. He trusted data obsessively, while other doctors relied on abstract theories about invisible vapors and bodily imbalances. Semmelweis began comparing statistics, patterns, and mortality rates. And one question started haunting him. Why were women dying far more often in the doctor's ward than in the midwife's ward? The patients were similar. The hospital was the same. The climate was the same. The city was the same. So what was changing? For months, Semmelweis searched for answers. He analyzed birth positions, room ventilation, patient diets, and numerous other factors. None of the explanations seemed sufficient, until one event changed everything. A close friend of Semmelweis, physician Cliothecary, suffered a small accident during an autopsy. While examining a corpse, Cliothecary was accidentally cut by a scalpel. Days later, he died. But the most shocking detail was that the symptoms he developed were almost identical to those suffered by women dying from puerperal fever. Fever, inflammation, widespread infection, organ failure. That was when Semmelweis had a revolutionary realization for the time. Every day, doctors and medical students performed autopsies on corpses before attending women in labor, and they did so without properly washing their hands. In practice, they moved directly from handling dead bodies to examining living patients. Semmelweis concluded that some kind of cadaverous particles were being transferred from corpses to hospitalized women. Today, we know he was describing bacterial contamination, even without officially knowing about bacteria. In 1847, Semmelweis decided to test his hypothesis. He implemented an extremely simple measure, but one considered radical for the era. All doctors would be required to wash their hands using a chlorinated lime solution before examining patients. The purpose of the solution was originally to remove the smell of corpses from doctors' hands, but the result was far greater than anyone imagined. Mortality rates collapsed almost immediately. Within just a few months, deaths from puerperal fever fell from over 10% to around 1%. It was one of the most important medical discoveries of the 19th century. But there is an even more shocking part to this story. Even in the face of evidence, many doctors refused to accept the results. So, had you heard this story before? Leave a comment below.